So, as both a psychiatrist and a man of faith, how do you see the connection between prayer and our pain, the role of the sacramental life, even in helping to foster mental health, where modern psychology doesn't seem to provide everything that maybe is needed for the sake of full healing and wholeness?
That's right. Yeah, thank you for that question. It's true. I think modern psychology and my own discipline of psychiatry, which is sort of the medical field, medical specialty devoted to mental health, tends these days to be very what I'll call reductionistic. They'll take the human being, the human person, and reduce the human being to just one aspect or one component of our humanity. So clearly we're enfleshed biological creatures, but psychiatry, for example, has a tendency to reduce the complexity of human experience just to the material aspect, just to, if I'm dealing with a problem like depression or anxiety, psychiatry tends to focus on, well, this must be a chemical imbalance in the brain. And that's not to deny that there are brain changes that occur with these disorders. There are, and they can be measured and assessed by imaging and other scientific methods. But the idea that the full range of our human experience can be reduced just to the material aspect, I think is false. And so I think the approach that Catholics want to take when we think about mental health is to see the human person in all of our complex dimensions. We're creatures of body and soul. We have problems manifesting at the physical material level. We have problems manifesting at the psychological level of our thoughts and feelings. And we have problems manifesting at the spiritual level of our relationship with God and our relationship with other people and our ability to develop and live the virtues, the supernatural virtues of faith, hope, and love, and the human virtues as well. And so I think it's important to take a both and approach to psychological healing, meaning in some circumstances, medical interventions, medications, for example, or other interventions at the physical level might be appropriate and helpful. I prescribe medications for mental health disorders routinely. They can be life-saving if used, prudently and cautiously. But we shouldn't reduce human problems, psychological problems, just to the material level. We should also attend to what's going on psychologically, what's going on in our relationships, and also what's going on spiritually. And I think that's nowhere more true than on the issue of suffering. And if I've learned anything in my clinical practice as a psychiatrist, it's first of all, everyone suffers. People who may appear very privileged from the outside, people who have lives that look like they've got it all together, and they have material blessings, they have professional success, they have external plaudits and awards, and looks like everything is going well, can be suffering interiorly in ways that other people don't realize. Patients disclose to me things, for example, that they haven't even disclosed to their spouses about wounds that they're carrying, maybe a history of abuse growing up, things that they've done, things that they've experienced that they're too ashamed to admit, even to close friends or family members. So everyone suffers in this life to a greater or lesser degree. And very often our suffering is hidden from others. And it's something that we carry alone, or something that we carry that only God knows about. So I think it's important for us to recognize that and to not assume that we know what another person is dealing with. And then as Christian men and women, to try to deal with it, both by offering psychological and medical help where that's indicated. Obviously, we are called as Christians to try to alleviate the suffering in the world. And Christianity is a religion of healing. Our Lord's public ministry was characterized by preaching, teaching, and healing many miracles, most of which involved healing various physical ailments. And so healthcare has always been part of the Catholic tradition. Yeah, the idea that we should use whatever, scientific means, whatever human means we can to try to alleviate suffering is deeply embedded within the Christian tradition. But at the same time, we recognize that in a fallen world, it is impossible to completely eradicate all suffering. And in fact, attempts to do that often lead us astray. So when medicine fails to find a cure for certain ailments, right, then there is a temptation in a secular society that doesn't understand the meaning and value of suffering to say, well, if we can't eliminate the suffering, let's eliminate the sufferer, right, through things like abortion or things like euthanasia or doctor-assisted suicide, which is often, obviously a misguided and misdirected way to attempt to deal with suffering. So on the one hand, we want to relieve suffering. On the other hand, we want to acknowledge the limits of that. And then the question arises, okay, with the suffering that's unavoidable, what do we do with that?
I wanted to get into the question of suffering, but before I do, I'm fascinated by your initial point, which is the reductionist view of so much of contemporary psychology. I myself have done a lot of work in the area of John Paul II's anthropology. I've become convinced that a false anthropology is the source of a lot of problems. It's the source of problems in the realm of ethics and bioethics and sexual ethics. It's going to be a source of a lot of problems in medicine. And so I guess I just want you to elaborate there because, obviously, we're not talking about exclusive, like faith healing sort of things when we're talking about bringing faith into the healing process. We're not talking about doing away with the medical attention that is necessary. Like you're saying, it's a both and that we're looking to do. But so many modern psychologists perhaps have a very materialistic view of the world or think that they must have a very materialistic view of the world in their profession in order to, try to approach these problems. They're going to be missing a very important component of what it means to be a human person. And if you get the person wrong, then you're not going to know how to address healing in the person. So can you speak a little bit more to that? And then we'll dive into the suffering more.
So that's a very important point. That's an excellent question. And I agree 100%. Many of the grave errors of the modern world and the ways in which our culture has gone wrong are rooted in a false anthropology, a false understanding of what is a human being created in the image of God, body and soul, intimately united, fallen and therefore wounded, but also redeemed by Christ and elevated through grace. That is in 20 seconds. That is a Catholic
great summary.
That is a Catholic anthropology, a Catholic understanding of the human person. If you exclude any one or another of those components, you're missing out on the fullness of what it means to be human. And you're missing out on opportunities both to alleviate suffering and then also to help people carry their cross when that suffering cannot be alleviated, and not only carry their cross, but find Christ